Really, we tell you what's really going on. I am Jocelyn Turner, your co host. So happy to be with you all tonight. And of course, I can't do this alone. Joining me as usual is actually, he's joined more usual than I have because I was missing in action last week. How are you doing this evening, Dr. Kane?
I'm doing absolutely fine. You can do it alone. Um, Most of the time when I'm on here, you're doing it alone. So that's easy enough for you to do. But last week, wait a minute, I forgot. Oh, last week's show was on dementia. So
Oh,
I tell you what.
I can't help it. Can't help it. It was too easy. But it was a very interesting show. I think this show will be just as good, if not even better, because of the topic that we bring. Both of these are particularly relevant in senior citizens in terms of what we're trying to bring today. But I'm obviously, and I will say it again at the end of the show. Obviously, I will want to have our guests back because this is a very diverse topic. Um, uh, um, uh, that applies to a diverse population of people. I'm talking about, especially when it comes to ages. So we're going to have to talk about other ages as well. But I know we were kind of highlighting today in terms of our senior citizens, for which I'm one of them. But I got to tell somebody. You know.
Speak for yourself,
So
Dr. Kane, because I thought we were talking about dental care for everybody because I don't consider myself a senior, but I digress. So, tonight, as you can tell from Dr. Kane's intro, we are discussing the importance of dental care as we age. And we are so happy to have from the practice of Smith and Smith Associates of Jacksonville, Dr. Ivan Smith and Miss Christina Dyer. How are you all doing this evening?
I'm good.
Wonderful, wonderful.
Thank you
Glad
both.
to be here.
And Miss Dyer, you have such a beautiful smile. OMG. I mean, just remind Dr. Smith, it didn't mean that you didn't, but
That's okay. He does have a beautiful smile.
so I love being around people who are in the dental field because they always flash their pretty smile. And so that's why I'm so happy that we're talking about a topic that, quite honestly, we don't talk about enough. I always like to end off or start mentioning something that someone told me, and Dr. Kane, I'm not sure if I mentioned this to you. I think I did. I was sharing I retired from the health department. I was talking to a former colleague one day, and either they were this is when the dementia thing, and I'm not saying that, I'm joking when I say it, but memory serves me incorrectly. I made the comment that I don't like flossing, and she said, oh, just only floss the teeth you want to keep. And so, and I thought, how very important that is, right, Dr. Smith and Miss Dyer? I mean, really, just only do
Absolutely.
the ones. So now let's talk about it. Why is it really important to go to the dentist on a regular basis, Dr. Smith?
I think when we're talking about healthcare, we really want to focus on prevention, and that's where making those visits twice a year at the bare minimum is going to allow the dental team to prevent something from happening. We can do the greatest filling or the greatest crown, but there's nothing better than what the man upstairs gave you. And if we can keep that healthy, then that is the basis of our mantra. We want to prevent the teeth from not being at its highest level. Now, we're able to repair teeth and keep them at a high level, but without that prevention, then we're really not doing the patient a service, and the patient's not doing themselves a service, because truly in dentistry, an ounce of prevention is worth a pound of cure.
You know what you said, Dr. Smith, that makes me, and Ms. Dyer, you can also comment on it. The thing that you said just sparked a thought in my mind. Just really, when you look at your health in general, your overall health, right? it's interesting how we segment parts of our body. You know, we'll take care of this part of the internal pieces in terms of our blood pressure, maybe, our blood sugar, maybe, our cholesterol, maybe. But we don't understand how good dental care is so important, even when it comes to those chronic health conditions that I mentioned, that we should look at the whole body that we've been blessed with having, right?
I want to comment on that one as well, Ms. Turner, because I think you're absolutely correct. And Dr. Smith hit the nail on the head when he talked about prevention. You know, being family practice and primary care, that's my whole mantra in terms of prevention. And you're right on point when we start isolating divisions of medicine, because as far as I'm concerned, dentistry is a division of medicine, even though when you talk about medicine, people don't usually include dentistry. They actually try to separate it as if it's a separate entity. So I guess if I'm really old and got some dentures in my mouth and can take them out, I can separate it. But other than that, other than that, you can't separate your dentition, your dental related issues from the whole well-being of your body. And so I just wanted to comment on that whole prevention aspect, because that was right on cue.
I agree.
And so since you spoke up, then what do you see? Because when people come in, you're a dental hygienist, right?
Yes.
So when you come in, and oftentimes, nothing against the dentist, but you're the first person that we see.
I'm the first person.
And the one that we walk down the hall of shame to, like, you're going to be able to tell right away what we have not been doing, right? So what's the biggest thing that people don't do right?
Brush and floss. Brush and floss. I have people that tell me I brush 6 times a day. I floss every time I eat, and it's not about how many times you do it, it's how effective you are when you do it. So a lot of what I do, more so than the cleaning, is patient education. Sometimes I have to do it hand over hand. I have to show a brochure. Sometimes I'm able to pull out my cell phone and do a picture. But it's about being, effective when you are doing it. I mean, there are places in your mouth that the toothbrush just can't reach. Or people tell me, I don't have time. I don't have time to floss. I don't have time to brush. And I said, did you take a bath last night? Well, put the floss in the shower. I mean, I understand. I get it. I right before I slid on this podcast, I might still have cream spinach in my teeth. But before I go to bed tonight, I'm going to do a really good floss, and I'm not going to sleep with that spinach in my mouth all night. So if you can't do it any other time, just make sure you get a good up and down, no shoe shining with the floss, up and down. Only time you're allowed to use your middle fingers when you floss. That's what I used to tell my kids. And wrap the floss around your middle fingers, pull up and down, and remove all of that debris that you had from all day long, so that you're not sleeping with that in your mouth. So, and a lot of people also with the toothbrush, I need a hard toothbrush. I want a medium toothbrush. And we always encourage people to have a soft bristle toothbrush. If I don't brush hard, it doesn't feel clean. Well, you're just brushing your gum tissue away. You want to massage your gum tissue and, just swiftly remove the debris. You don't want to basically scrub the enamel away and scrub your gum tissue away. So mostly brushing and flossing. I see people who they do it all day, every day, but they're not effective when they do it.
Oh, I've been using sandpaper then.
The shoe shine. Never heard that. The shoe shine. Okay.
Yeah, when you're flossing and you're going back and forth in that one spot.
Yeah.
Because it's feeling so good. You massaging your
I know, but you can't. You're just making pockets, and you're just creating another space for more debris to get down in there a little deeper sometimes. You don't want
to visit Dr. Smith, right?
Yeah. And also and people think it's funny, but when you're brushing, if you're not doing the ABC song or doing the wheels on the bus go round and round, you're probably doing it wrong.
Oh, that's funny.
That's how they taught us elementary, but it's the right way to do it.
No, but
let me ask you, which is better, hand brushing, or do we power,
Electric.
brush,
I guess
electric, battery power, whatever? Is
depends on how much
there?
oomph you got on it. If you how much stank you got on it, Dr. Kane. If you're really brushing really hard and you're scrubbing, you don't want to do that. And I think that when we have a power brush, because we are in the tendency of moving our hand back and forth, we have the power brush spinning and we're still doing this. If we're going to do this, we don't need the power brush. So you just want to make it spin and you just move it front to the next tooth, to the next tooth, to the next tooth, and let the toothbrush do the job that it's supposed to do.
So take your time.
Take your time.
Yes, absolutely.
Take your time.
Yeah.
Slow down.
Instead of
Take your
going
time.
in, okay, I'm ready.
That's why you should do a good one before you go to bed at night. So if you get up late,
Yeah.
you won't have to do that rush job in the morning.
Or
Unless
get
you
up in the
sleep,
middle of the night and go, I forgot to brush my teeth.
right. Unless you
brush it.
sleepwalk, unless you're gonna
Yeah.
sleepwalk eating, then you can kind of.
So, Dr. Smith, she mentioned, going to bed with that cream spinach in your teeth. Does it really hurt when you go to bed, hurt your teeth when you go to bed without getting the food of the day out of your mouth? In between your
Absolutely.
teeth?
Absolutely. In our mouths, the bacteria is constantly at work. So our job is to try to find ways to limit their source of food. So if you're leaving that, they get a chance to just basically have a party at night, and that bacteria is going to create not only acid, but it's also going to create be able to proliferate. So when we're talking about taking care of the teeth, we're not just talking about the actual tooth itself. We also need to worry about the gums and the bone, and that's really what our biggest fight is, maintaining that apparatus to support the teeth, which are the gums and the bone. Because periodontal disease is a low-grade infection that causes so many other problems, can lead to so many other problems. And Christina she's my frontline person for that. Matter of fact, what would you say in your dealings? Because Christina has done a lot, especially with going into. We talked about this today. I want to say the politically correct. What is it? I don't want to use the word old folks home because
long-term care facility.
There you go. Found on because we have different rates of what we want to see patients. In typical, it's twice a year, but that changes depending on what is going on with the patient.
Mm-hmm. Absolutely. So we have people who have, beginning stages of periodontal disease, and there are stages of periodontal disease. It all starts with the infection, gingivitis. And we see our gums bleed. And I have to tell my patients all the time, if you got up every morning and flipped on the light and Dr. Kane, if their hand was bleeding every time they flipped on the light, they would be in your office before you got there. Every morning when I wake up, I flip on this light and my hand starts bleeding. But every morning when they get up and brush their teeth and it's bleeding, they don't come to the dentist. They say, oh, well, it just bleeds a little bit. Or when I spit it in the sink, I see a little bit of blood. Nope. Okay. So that's the beginning infection, gingivitis. Now, long-term infection of gingivitis is what causes periodontal disease. And that's when the bacteria starts to eat away at the bone and you have loose gums, red and bleeding. And a lot of people say, oh, I have pyorrhea and all this stuff, the old terms for it. So they start seeing, a lot of deterioration in their mouth and their teeth start to get loose. So we want to catch it at the stage, if you haven't already started, or maybe you've already gotten the gingivitis and you're in the first stage or the second stage, we want to stop it before it gets any further. So when you get to that stage, like I said, sometimes it's not even being that old. Sometimes it's a little younger too.
Oh yeah.
We could stop it, but your recall is a little higher in the office. I have people that I see every 6 months, that normal recall. I have people I see every 4 months. I have people I see every 3 months. And when I was traveling and doing hygiene in the long-term care facilities, I saw those folks every month. And that's because sometimes they even though they don't have teeth, people don't think, well, let me look in their mouth. They have a denture on, they don't have teeth, so I don't have to do that. So we still have to look in their mouths for that same bone loss, because the bone starts to shrink. Sometimes there's food that's lodged on the sides, and that may cause lesions and ulcers inside the mouth. So we still have to check, even if people don't have teeth, they still need to come in at least once a year. If they're, not, like I said, long-term bed-bound people need to probably be seen a little bit more often, just for chronic illness and things like that. But usually the recall changes depends on the stage of periodontal condition.
I tell patients, I know Dr. Smith and Ms. Turner knows, I like to use examples or analogize things as to what they, how you can relate to it in the real world. And Dr. Smith said it as well as yourself, that we are, the bacteria goes in and it metabolizes and different foods. Those bacteria are trying to live, so they're consuming those foods for energy, and then they poop in your mouth. Literally, that's what they're doing.
That's the truth.
That's why sometimes your mouth smells like poop. But if you don't go in and brush your teeth and floss them, you just got a poopy mouth. And so, I know it sounds gross, but there's nothing untruthful about it. The bacteria is doing exactly what it does to survive in terms of metabolizing different substances. Those substances cause deterioration of your teeth and the surrounding gums, as well as the bone. And so if you want to prevent that poop accumulation, you got to floss and you got to brush your teeth.
Absolutely.
So why is it that older people have an issue with their teeth or oral health? Is it because of aging, or is it because of some other chronic health condition?
Is that for anyone?
Well, I actually believe that there are different stages to that. Certainly over time, as we are fighting this good fight, we are going to lose bone levels. So if you look at a patient who is 25, you expect to see a really high bone level, as opposed to someone who's 55. That bone level has decreased over time, and that opens up different areas and pockets for the bacteria to get to. With our practice now being 26 years in, we have a fairly older population that we are treating. So what you'll tend to see is that bone level between the teeth is no longer right up sandwiched in there. It's now gotten flat, and that's a nice place for that bacteria to park an RV and cause some damage. So part of it is just the wear and tear of getting old. Then the other part is, to another extent, what our dexterity becomes as we get older. Because whatever your dexterity is at 25, it's not the same at 55, and it's not the same at 75. And now that I've got a good number of patients who are in their 80s, they're not able to get to those areas that they've always been able to keep clean. So you'll see that gradual decrease in their ability to keep their oral hygiene as high as it used to be in their 20s, 30s, 40s, and going on. But that's just you say, we all have a certain amount of time to have that level. So you really have to look at the patient and treatment plan them to be a little more aggressive as far as with their oral hygiene and protection. So we'll tend to want to put a lot of those older patients on extra fluoride.
And it's so interesting, as you were talking, I was thinking how when we're younger, we're so in tune with keeping our bodies in shape. We're dating. We want to look our best and nowadays for social media, for photographs. But the older we get, people tend to not pay as much attention to detail about their bodies from head to toe. Wouldn't you all think? And any of you can comment on that.
I agree with that. One thing that I find with my Asian patients, a lot of them don't notice that their saliva flow is less. No, they haven't noticed it, but oh yeah, I do always suck on mints and things like that. So they'll start saying things like that, but because of medications, chronic illness, their first line of defense in their mouth, their natural Listerine has been diminished. So sometimes they have drier mouths. That bacteria that's in our saliva that helps us to break down food, to kill some of that bacteria, has diminished. So some of those things, yeah, you don't notice until somebody asks you, have you noticed dry mouth? Have you noticed dry throat? Have you noticed, yeah, when I wake up in the morning, my tongue is a little dry. Things like that you just, don't notice that it's slowly happening.
Now that's my cue to bring in when I see patients in my office with the dry mouth. They have the white coated tongue. They have the sore throat, especially when they get up in the morning.
Mm-hmm.
That's my cue. And one of the things I have to make sure patient realizes that they have got to keep their mouth moisturized. And the way to do that, one of the first line is just drinking enough fluids. And when I say fluids, I'm mainly talking water. Mm-hmm. Not talking orange juice or sodas, because now you get into a whole different things where you got to worry about diabetes and you got to worry about the effect of the sodas and the acid that they have and the orange juice and the acid that it the impact that it has. Are there any foods or drinks, speaking of dry mouth, that that can also injure your dentition, that we need to be especially cognizant of and express to our patients? I need to express to my patient, be careful about consuming these foods.
And also, before you answer that, because I read something today in preparation for the show, and it just prompted a thought when we talk about choices. Like, for instance, I drink a lot of bottled water. Am I missing the fluoride that I would get from tap water? So just if you would kind of roll all of that in, one of you, in your answer.
Doc,
you want Chris?
I mean, I mean, I agree. I see, like I said, I do a lot of patient education. It includes nutritional education, a lot of coffee drinkers, caffeine, is drying. It's a diuretic as well. So people don't realize that I'm drinking this coffee or I got on this blood pressure pill and it has a diuretic in it. Everything's coming out. You have to put that back in. Soft foods like, the pretzels and chips and things like that. We have to talk to the younger people, especially those in orthodontics and braces. Those soft foods, they get caught in your teeth, they get caught in your cheeks. And sometimes you have to do a little extra to rinse those things away. Highly acidic foods. A lot of people like spicy and they like lemons. I have people that suck on lemons and things like that. So I can't personally do it. I have heart issues. I
used to love lemons.
I was like, but I mean, those things like that, the highly acidic foods, sometimes acid reflux affects what happens in our mouth. We have people that, we sleep, they have acid reflux in the middle of the night. We have mothers that are, pregnant people that have morning sickness. And the whole time they're chewing on the Tums or they have acid reflux during the pregnancy. So we have to talk to them about keeping the pH level in their mouth, sometimes swishing with a little bit of baking soda and water, just to keep everything neutral in their saliva. But as far as foods, everything in moderation. Everything has to be in moderation.
Dr. Smith?
Well, I really would be more focused on not so much of the actual liquid or food being so damaging directly, but more indirectly when we're talking about drinks with high sugar content in it. And now these days they're pushing sports drinks and even the sodas. When you're constantly bathing the teeth with a high sugar liquid, you are going to increase the incidence of caries.
Acid
So
attacks.
you can have someone that may go between their 6 months, and you saw them 6 months ago, they look great. They start building this habit of just sports drink, sports drink, sports drink, sports drink, sports. You see them 6 months, they got cavities all over their mouth. And you're like, oh my goodness, we got to get you on some fluoride. And to the question of drinking bottled water and not having the fluoride in the bottled water, if you're since we're all Floridians, that's not that big of a deal because we're adults, because it's already in our water growing up. So that enamel has been formed in a harder type of enamel by ingesting that fluoride as you growing up. So as an adult, it's not as big. I mean, so drinking bottled water, not a big deal. But for children, if they're doing the drinking of the bottled water, that is a big deal, because then they're not getting that enamel reinforced with the fluoride that will be resistant to the sugar. But my biggest concern is in society, everything's about sales, sales, sales. And then you see commercials. I want to be like Mike and drink the Powerade and this drink and that drink. And the kids are like, well, it's got to be good for you. Not for the teeth.
Which then means not good for you necessarily, but ain't good for the teeth. And then the fluoride, as you said, you were saying fluoridiums, and not fluoridians. Floridians. The issue with the Floridians is that we have a very transient population. If you guys, we got a whole lot of Northerners that are coming in. It's rare, and I say somewhat rare. In Jacksonville, one of the things people always ask me, Dr. Kane, you from Florida? Like, yep. Which they're going like, oh, I didn't think you were from Florida. It's like, I don't know why. I'm from South Florida, but it's still Florida. So you have a lot of I'm going to call them immigrants without being politically incorrect. But we got a lot of immigrants in Florida. So fluoride in their water growing up is a big issue, because they may have come from a state that is not required, or it is not in the water in that state. Right. Now, I don't know anything about the individual states, but we can't make the assumption that those people were exposed to fluoride growing up, as kids.
It sounds like there's a Kentucky joke there, but leave that alone.
I
know that's coming up, but okay.
So for people who have diabetes or some other chronic health conditions, are they supposed to should they do anything extra as far as their dental care is concerned? Should they let both their physician who's treating the chronic health condition know that they're going to the dentist on a regular basis? And should they let the dentist know they have diabetes or high blood pressure or something? Is it important that the total patient health history be shared and known amongst, all providers managing the health conditions?
Absolutely. But to speak more on the diabetes and where that lies with the how important it is with the mouth. Like I said before, the mouth is under constant attack from the bacteria, and an uncontrolled diabetic is at probably a high level of concern in a dental practice, because that's the person who's going to come in with not just gums bleeding, but fire red, possibly mobile teeth, everything hurts. And at that point, we really have to ascertain where we are. And one of the questions I always ask a patient is, if I see a lot of bone loss on the x-ray, I'm going to double down. Even if I've checked on the medical history, I'm going to ask, are you diabetic? And if so, how often are you checking your blood sugar? And what I tend to find is that those patients who are at the high level, but they still have a lot of bone, I am going to want to get them in to see a periodontist, because we still have time to make decisions that can save teeth. But the bulk of a periodontist practice is a lot of patients who are usually uncontrolled diabetics. Controlled diabetics we can manage. I'll let Chris say this. For the most part, if you are doing your part, making sure you're eating correctly, managing your sugar levels, we may have to do an extra level of cleaning on you, but not always. So,
Yeah. Not always. For me, it's like Dr. Smith said, if it's uncontrolled or controlled, and usually you can kind of tell the uncontrolled. I do get those patients back on a higher recall. Those are the patients that I probably will see at that 3 or 4 month, because they are having periodontal issues. They're slow to healing. So if we do that deep cleaning, sometimes we have to have them come back for a post-op visit to make sure they're healing properly before we go into another section of the deep cleaning. I've had patients that had diabetes and had a deep cleaning and their A1C went down because they had an active infection. They were walking around with an active infection in their mouth until they got the cleaning done. So I have seen blood pressures improve with higher recalls. I've seen A1C improve, and just, overall health, because now these patients are aware that this cleaning, I mean, you can eat right and do this, but if we're not going to take care of our entire body, we're still going to have a high A1C. We may still have elevated blood pressures. So it kind of brings it home, like you were saying, Dr. Kane, earlier, about dental health being a part of your total health.
Right.
And my sister's a family physician too. So we debate quite a bit.
Yeah.
Quite a bit.
Well, let me chime in at that point, because when it comes down to the A1C, a lot of my patients come in and they want me to give them a good report, and they want to please and want to see that when they come in, their sugar looks great. And when, just going back and talking about A1C, I try to remind them that, yeah, you come in to see me today, you come in, your sugar looks good, because that's a picture in time. I took that sugar, it was like taking a picture, and whatever that sugar is at that moment, that's what it's going to always be like, taking a picture. If I took you guys' picture right now. See, but that A1C is a video. Tells me what's been going on for the past 3 months in terms of your blood sugars. And because your blood sugars have been elevated most of the time, okay, not just fasting, sometimes they're fasting, their blood sugar look okay.
Right.
But after they eat, the blood sugars are high. And to your point, when those blood sugars are high like that, it does fester bacteria. The bacteria in itself can be a cyclic phenomenon, where because you got that infection, it's causing your blood sugars to be high. And so, when it causes blood sugar to be high, and the effect on your teeth causes on your dentition causes deterioration of that dentition, and you continue to have that deterioration, then a lot of times we tend to see those blood sugars remaining high as a result of the infection. And so you have to get rid of that. And not all the time is it antibiotics. Antibiotics can play a role in it. Dr. Smith, if he sends when he sends patients to me, because he's getting ready to do a procedure. I may put on antibiotics, which raises another question that I'm going to ask. They may put on antibiotics. They may take care of it for that moment. But if you go right back to the same habit you had before, and that is not control, not doing the floss, not doing this, that, or the other, and your teeth get reinfected, then we're right back to square one, maybe without the pain or discomfort, but still you right back to square one where you have the deterioration. So that brings to mind a question that I'm thinking about, Dr. Smith, in terms of those patients who come in, you're getting ready to do a procedure on them, and blood pressure plus or minus may be fairly controlled, but we want to know if they need antibiotics, because that's a key question that they're always asking me. My dentist says I need antibiotics. What's your thoughts on that?
Well, we try to keep the issuance of antibiotics to purely a situation where there's an acute infection, like a tooth that actually has an abscess, and we can radiographically tell, or patient has facial swelling. Then we may actually issue that antibiotic before treatment so we can get the infection down, because a lot of times if that infection is really heavy, then the anesthetic won't be strong enough so that you can do the work that you need to do. But that's usually, that doesn't happen that often. What usually is the case is patient comes in, has a toothache, we're still able to get that patient anesthetized enough to do the work and remove the infectious tooth, and then we'll do an antibiotic after the extraction is done. Now, in the case of periodontal disease, we may do it before we start the treatment if it is really a case where we got a runaway train here.
Severe infection.
Right.
Yes.
Severe. Especially if they're medically compromised. They've had issues like heart issues or
That's 2/3 of my patients, by the way, but go ahead.
Really. Heart issues, recent heart attacks or stents placed. If they've had stroke or especially transplants, because like I said, the same plaque that you have on your teeth, the same plaque that gets in your arteries, that clogs up your arteries, and you want to make sure that bacteria, and people don't realize your mouth is really close to your brain and your heart. So you don't want that bacteria there. I personally, after I'm doing my deep cleanings or my scaling and root planings, I usually would recommend an antibacterial rinse that they would use mostly after the deep cleaning. But sometimes I may say, hey, you need to go ahead and start now using it. We're not done with the deep cleaning, but you can go ahead and start using it now for a couple of weeks. And when they come back to get the other part of their cleaning done, we'll reevaluate and see if they need to continue using that antibacterial rinse.
Dr. Smith, I know you're the guy that you get in there and you're trying to you're the next step after prevention, and which I see a lot of is prevention was a non-player in this game because they didn't do it. So we're at that point where we have to use your expertise and your services. One of the things that, and since she's mentioned how close your teeth are to your brain, I tend to see a lot of patients with sinus infections. And then, of course, sinus infections in very, very extreme cases can lead to, various brain infections, meningitis, whatever. But particularly, let's talk about sinus infections and the ability that, or the possibility of a bad tooth causing sinus infection.
Okay, what you usually see where that's going to occur, it's going to usually occur with the molars, with the upper molars, teeth 1, 2, 3, 14, 15, 16.
All right,
So
now remember, you talking to a crowd that may not know anything about the numbering. I know about the numbering because being a patient, and it's like it's on my board exam. But but
okay,
talk to those
so
patients that don't know.
so to put those into perspective, we're talking about the molars, the big teeth in the back, all the way in the back, and maybe sometimes the premolars, but the teeth that we're going to do our grinding with, but specifically the upper teeth, because we're talking about the maxillary sinus. And what we don't what most people don't realize is if you take a picture of the floor of the sinus, it kind of has a little curve to it on most patients, but some patients it almost, if you take the molars, they upper molars have 3 roots. If you take those 3 roots, sometimes that sinus almost goes right in like a wave. So if that tooth gets infected, and especially if that infection can fester long enough, you can get that infection to come through. Usually it will come through towards the cheek side, but sometimes there can also be a communication into the sinus. But always, if the infection is able to fester, it's going to mimic a pain in the sinus, and you will have to be worried about if the tooth can be saved with the root canal. Is there communication? And certainly, if you're taking the tooth out, is there communication to the sinus? What you really want to stress to patients is your body tells you something. Listen to it.
Right.
Do not let these things fester. And I know a lot of patients tend to let toothaches fester because of the fact that they're scared of coming to the dentist, because either the drill or the bill. But either one could be lessened. What's more important is getting in there to prevent that infection from spreading, especially to the sinus cavity.
Well, let me just do a little point of simplicity from somebody like me. That's I'm a simpleton.
I understood
The
it, Dr. Kane.
uh,
I understood it. I thought he described it pretty good.
oh, I'm trying to make sure that everybody understood that it was. You start talking about that sinuses, and
Oh,
you
yeah.
want to
No,
make sure
that's fine.
that he's saying that
It was the hands, Dr.
penetrates
Kane. It was the hands
that
that
did it.
did it, to
Okay,
help him
all
understand.
right.
He did
It-
mention something
That's why
that
you're here, because you're non-medical, and we
right.
need to make sure if you understand it, we can go for the rest of the audience.
So, Dr. Smith, you said something though that prompted a thought, because you said it's the drill or the bill. But in all seriousness, a lot of people don't go to the dentist because they can't afford it. Are
Right.
there any options for people who cannot afford dental care?
Well, that's a loaded question.
I mean, I don't know if I know there are federally qualified health centers in the area, the Agape Community Health Center, Sulzbacher, as 2 examples, but does the federal government offer assistance, to your knowledge, for people who cannot afford? And I really want to talk about adults, because I know the health department does a lot as far as
Children.
dental care for children. But what kind of assistance do adults get when it comes to their dental care, so they won't end up in the emergency room with dental issues?
Uh, well, usually we were talking about Medicaid when we're talking about for adults and government assistance. But what the government is actually going to cover is really state dependent. So I've had several instances where I'll have a patient who's moved from the north, maybe like New York, and I will take a look at them and do a treatment plan or a full workup, and I will tell them now Medicaid in Florida won't cover a lot of things that Medicaid in New York will cover.
Wow.
So outside of programs like you said, Salzbacher, Agape, there really aren't that many avenues to help adult Floridians other than being able to get on Medicaid. And if you are able to qualify for a plan like a care credit plan to dissipate the cost of doing work. The unfortunate part about the way our lives are set up is that at the time that we are winding down our careers and our financial ability to make money is right at the time that we need the most money for our health. And there's no way to get around it. Dentistry is not inexpensive. So
well, I think what you've done, what Ms. Turner, what you did when you asked that question, you come full circle. And that is that dentistry is not treated as a medical condition, okay, like it should be.
correct.
It should be covered like many other medical conditions.
I agree.
And because of that, you have to pay out your pocket for treatment that is a medical condition. Pyorrhea is a medical condition. Okay, a dental abscess is still a medical condition. Those infections of the mouth, they can result in worsening or worsen medical conditions, as in heart-related valvular, heart valves being infected and causing different issues like endocarditis, which is just infections of the lining of the heart, and so on and so on and so on. So that's why I say it went full circle with where we started the conversation at, and that is dentistry should be treated as a medical condition, as the rest of medicine is being treated, and should be paid for in the same vein as if I was treating a heart attack or treating high blood pressure or elevated cholesterol. Should be treated in the same vein as that.
The Jacksonville Urban League is working on an initiative with some other dentists around the state of Florida, other organizations who are advocating for, as far as addressing adult dental care here in Florida, because it really is a big deal. And by the way, I can't help but mention it because a question was asked about, 2 questions were asked, and I want to make sure we get those answered before we enter in the show. One was about teeth whitening.
Mm-hmm.
Yep.
And then the other was about, because there are so many commercial products about teeth that, advertise about teeth whitening. So I want you to talk about that and then talk more about deep cleaning.
Yep. There you go.
I saw that in the chat.
Okay. You want to take the deep cleaning first.
Okay. I think the question was what was exactly a deep cleaning? Is that, if I remember seeing it pop up?
Uh-huh.
Well, there are different types of cleanings. There are your basic cleaning that you would probably get when you're a little kid, or you just don't have too much going on in your mouth. We call it a prophylaxis cleaning. So there's, I just use my electric toothbrush and my toothpaste with some pumice in it, and to kind of go around and smooth and go, remove the soft plaque. And every now and then I may have to use my scaler and do a little picking there. So that's kind of like the basic. I know you don't like that, Mr. Turner, do you? He's like the cat scratching on the chalkboard. I know, but we that's like your basic cleaning. Just a little bit of plaque, maybe a little bit of calculus, not too much stain. That's our basic cleaning. Now we start getting into our periodontal cleanings, and we call it scaling and root planing, is because we have to go a little past your gum line, a little past where the enamel stops, and go onto your root. And so there's levels to it. What Dr. Ivan mentioned, going to see the periodontist, that is like the dentist of hygiene. So that periodontist in the office, my tools in general dentistry and not being where I have to he has to make a flap or something like that, basically cut open the gum so I can go all the way down on the root. Because sometimes I blow air and I can see all the way down to the bone on some people. But there's like a certain depth that I can only reach without you being in a surgical setting, and that's about 6 millimeters down with the tools I use daily. So if you have a pocket that's 6 millimeters or less, meaning that if you look at a little ruler, it's probably about a centimeter down from your gum line where your gum's supposed to be. We go down in that area and clean out those pockets, and that's considered the deep cleaning. So it's under your gum line. I know people say you're going under my gums. Well, that's where I'm supposed to be. It's a deep cleaning. Sometimes the gums aren't there. Sometimes it's just the tooth and the root. The gums have receded, really, really low. So it's still considered a deep cleaning, even if the gum tissue is not up to the level of the enamel. And people get cavities on their roots. So we do have to look for root caries, make sure that those pockets are cleaned out. Like I say, if it's deeper than 6 millimeters, you're going to be referred out to the periodontist, and they may have to do some surgical procedures on you. But most of the time, if it's 6 millimeters or less, meaning you don't have really, really deep pockets and not advanced periodontal disease, we can take care of you in the general dentist's office. There are things that we can do to make you very comfortable. You don't have to be put to sleep. A lot of people say, oh, if you're going to do that, you're going to have to put me to sleep. I promise you, I specialize in seeing the chickens and the scared people and the babies. We'll have, you can listen to your music. We can numb you up. And we do have anesthetics that don't require a needle. Some things are topical. Look, Dr. Kane's like, no, you can't tell me that.
It's a needle.
And a needle's a needle. But there are some topical things that we can do, and a lot of things that we can do in the office to make the procedure as comfortable as possible. Because if you're really tense, it makes it hard for me to work. So I would like for you to be as comfortable as possible when we do the deep cleaning. As for the whitening on my end, I whiten probably twice a year, maybe. And it's just, I don't know if it's probably just me and my job. I feel like I need to do that. but some people are candidates for whitening. And I think that's important that a lot of people need to know who's a candidate and who's not. If you have deep intrinsic stain in your enamel, sometimes you may not be a candidate for whitening. And I wouldn't tell you that you are. And then you go and you do the whitening and the bleaching trays and you're like, hey, it's still the same. It doesn't look like it's any different. So you have to be a candidate for whitening. Sometimes it also has to do with sensitivity. A lot of people have sensitivity. When the wind blows, they're like this because the cold air is too much for them. So whitening does take off, a few microns off your enamel that leads to you opening up those pores in your enamel, and those pores send that message to that nerve, cold, 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 cold. So we don't want to take any more microns off if you're already having sensitivity. So there's you have to be a candidate for the whitening. If you are a good candidate for the whitening, it does work if you're compliant.
Yeah, I just like to add on the whitening. What we typically do in our practice is we like to first know that your oral hygiene is good. I think that's important. And when you mentioned about the TV, the TV is not telling you, well, first you got to make sure your oral hygiene is good. That is actually should be a given. So you really should come in to see your dental professional, and so that you're a good candidate for it. And then second, we like to use a soft tray that is a mold of your teeth, so that way you can reapply the bleaching gel when you need it and as you need it. So you say you've got graduation upcoming, you've got pictures, you've got a wedding. Those trays will be flexible enough that you will be able to use those trays over and over. Now, the material that you can get over the counter is not as strong as the material you can get from your dentist. So I had patients ask me, well, do the Crest white strips work? Yes, they work, but you're going to have to use a whole lot of them. in a long time. And they made it that way on purpose. So
Yeah.
I think it's just better. Seek out your dental professional and start there. Make sure you're a good candidate. Get the bleaching trays. We often tell our patients, whenever you need some, come in. We use a bleaching material that is at a high level, but we make sure that if you are going to get some sensitivity, we have desensitizing gel to go along with it. And last thing is, whenever you're looking at those products over the counter, and I'm probably getting in the weeds a little bit here, Doc. I know you're gonna say, come on, they're not gonna know what. There is the active ingredient in bleaching material that actually works is called carbamamine peroxide. If it does not have that at the very beginning, don't you buy
and the right concentration of that to be the most effective. So what it sounds like you're saying to me is at the end of the day, it may be that all the monies you spend cumulatively getting the over-the-counter products, when you add them up, they may equate, if even be slightly more.
I was getting ready to say probably more.
More.
Yeah, slightly more, whatever. I don't know what degree, but even more than if you just went into your dentist and got it done.
Correct.
Okay.
Absolutely.
In one procedure that
Right.
you don't have to worry about every day in terms of doing
We have a question that was posted. Are those water power picks washes worth the investment? Do they do more harm than good?
Take it away, Chris.
I usually suggest power picks if you have orthodontics, if you're in braces and you're having a hard time removing food from it, because the worst thing can happen is you're in braces for 2 or 3 years and you come out of braces and you have a cavity in between each one of your teeth. My daughter was one of those people that flossing. So it's hard to floss for some people. Those dexterity issues that Dr. Ivan spoke about earlier is real. And especially for guys, sometimes not dexterity, their hands are really big. They can't get back there. So if you know that you have orthodontic material, if you're doing bridges and things like that, where you want to get underneath your bridge, or you have a pocket that always packs food in that area, I don't think there's anything wrong with using those picks. Now, the rinses they put in it, I'm not sure about that because I'm not sure exactly where rinse, and I don't want to tell you not to use a use a rinse, but sometimes I have done periodontal rinse, like a Peridex. It's the chlorhexidine rinse, the antibacterial rinse in there that you can put instead of the water, put that in the pick, and I've used that before. But I don't want anybody, going out and getting something super expensive, if you don't really need. I think that's another thing that you would need to come in and have your dental provider evaluate you for those kind of things. Don't go out and just buy a $200 pick and then you find out, hey, this is not for me. This is something that your dental professional can help you choose the right products for you to use, where you don't have to spend $200, $300 on a toothbrush, or you don't have to buy the wrong type of floss. There's different type of floss. Your teeth may need this type of floss, or for my teeth, I need Glide. It's a flat ribbon floss because my teeth actually breaks floss and then I have to floss the floss out. So your dental professional can help you choose the right products for your dental care if you have those concerns about what to buy and what not to buy.
Okay.
Wow, well, tonight's discussion has been very informative. We don't like keeping our guests any longer than we promised, so we're so thankful. And I know I personally learned a lot, even though, full disclosure, this is my dental practice. So I am appreciative of what they've done for me. So,
but they were not chose. They were not chose because
for that reason. Nope, I didn't know who you chose.
Made that choice.
Exactly.
Okay.
That's so true. So, but anyway, I'm still promoting them, right? But anywho, there are a lot of good dental practices here in Jacksonville, And we always like to give our guests an opportunity to give their final thoughts for this evening before we end the show. So I will start with Ms. Dyer, or
Okay.
Christina, as Dr. Ivan says.
It's fine. I answer to either one. My final thought, and we kind of said it, and probably needs to actually be reiterated, that oral health is a part of your total health. It needs to be taken as seriously as you would take, like I said, if you turn the light on every day and your finger bled every day, if you see your gums bleeding every day when you brush your teeth, that is something to be concerned about. It is a part of, whether or not your blood pressure, your heart disease, A1C, diabetes, some of the simple things like even a common cold, you can see signs in your mouth. My mouth starts to get dry. When I get nervous, my mouth starts to water. There's a lot of things in the oral cavity that show up with different emotions or sicknesses or, that we have. So I think that it's very important to just pay attention and be cognizant about what's going on with your body. Just pay attention and listen to your body.
Thank you. Dr. Smith?
Well, yes, I'd like to end with saying that I'm glad we had the discussion about how medicine and dentistry, and for some reason, especially here in America, we separated the two, and we as a society need to try to work to bring those two back together, because you cannot have a healthy body with poor dentition. You can't chew your food properly without proper dentition. You can't get. I have several patients who, when we finally get them into a set of partials and dentures, they're so thankful because now I can eat my food, I can taste my food, I can grind my food up like I used to. And what we need to continue to have this discussion and talk to lawmakers and try to get where teeth are not separate from the body. And we've just got to hammer that home, not just to our lawmakers, but also to the public, so the public understands that, listen, it is part of who you are and how you develop your health. So I'm very appreciative of this time.
Thank you so much. And thank you also, Christina. Dr. Kane, do you have any final thoughts before we end the show?
Well, I think Dr. Smith stole a whole lot of my thunder in terms of bringing together the fact that your oral health is committed to your overall health. That you must have good oral health, because most things that enter, other than what you breathe in through your nose, everything else that enters your body comes through your mouth. And so however your mouth, however efficient or inefficient it is at processing those items that come through your mouth, whether it's chewing, whether it's because you're drinking, whatever it may be, whatever those items are that enter your body affects your body positively, negatively, however it may be. And so we need to consider, as Dr. Smith said, your oral health to be consistent and integrated or integrative with your overall health. There's no, I can't see why we're still separating the two. Last week, we talked about your mental health as it relates to Alzheimer's. We've talked about mental health in the past as it relates to the individual, how they're functioning. Why in America we're separating body parts, whether it's the brain and its functional capability as far as it relates to psychiatric health, mental health, or whether it's the mouth in terms of your dental health and the effect that it has as it relates to the things that you ingest that will affect your overall health over time. it befuddles me. I don't understand. Okay, and so I think that we should start considering, um, and as he said, let's begin to talk to our legislators, to the people. If they really want to save money in terms of taxpayer dollars, they can really start uh, with mental health, but especially with, because of our subject tonight, our topic tonight, with oral health. You, in the long run, when you take care of these dental issues from financial standpoint, you will take care of a whole lot of budgetary issues as it relates to health standpoint. The monies that we spend with Medicaid or whatever else, Medicaid, Medicare, we take care of a whole lot of those issues if we attack it from the beginning, i.e., preventive,
Right.
whether it's mental, cardiovascular, dental, you name it. We have to start in terms of prevention. So I think our guests, I really appreciate these guys and ladies. Sorry, no disrespect. I really, I really appreciate you guys coming on and enlightening us as far as dental health is concerned. And then I hope that in the very near future we bring you back because there's more specific. We did an overall general overview of dental health. That sometimes we might need to get down to some specifics and a whole lot of our topics, and we will do that at some point in time. With that, I'll
I
take care.
definitely have way more to say, so I'm ready.
By the way, who's your sister? Are they in Florida?
She's in Georgia. Her name's Davina Dyer. She went to undergrad in Florida, and then she left us and went to Georgia for medical school and decided she wasn't coming back.
She went to which University
Morehouse.
of Georgia?
She went to Morehouse.
All right, I'm a Morehouse graduate.
Okay.
Yeah,
Okay.
out of that first class of Morehouse.
Okay.
I'm proud to say.
She is very.
1985. Well, that part, 1985. I mean,
Yeah.
first graduating class out of Morehouse.
She is a very proud graduate of Morehouse School of Medicine, and we, like I said, we debate. In fact, we get into debates quite often about her as a physician. How often does she refer her patients to the dentist?
Yeah, well, I refer.
I know you do, Dr. Kane. I know.
Yeah.
I think that'll be a discussion for in the future. But
That's what I
anyway,
said.
I leave it alone.
That's what I said.
Sorry,
I know you do, Dr. Kane. It's okay.
Yeah. Sorry, guys.
So-
I digress, so I leave it alone. Go ahead, Miss Turner. You can close out.
So again, as you can tell, we had a very lively discussion about those pretty white teeth that we hope to have. And for those of you who don't, seek dental care. As you can tell from tonight's discussion, it is very important as far as your overall health is concerned. Thank you for tuning in to Pause for the Truth. Tune in next week. And don't forget, if you have not gotten vaccinated, have not received the COVID-19 vaccine, please go out and do so that we can resume life before COVID-19. Take care.
I will say, Ms. Turner, before you leave, I will say, at my practice this Friday and the following Friday, we are doing a booster and as well as initial COVID vaccine shots. We're from 9 to 3. We're having vaccines available, and that we're welcoming anybody that wants to come get the vaccine. We're encouraging it at the same. And with the last thing, I cannot forget our technical guru, Mr. Tyrone Jackson. And call Tyrone. I can't sing like a girl does, but you can imagine what I would say if I said call Tyrone. How I would sing it. Mr. Turner does a better job. But call Tyrone.net. He can supply any of those technical issues that you need. If you guys don't have someone to refer to, I guarantee you, stake my reputation on, he will take care of any of your needs.
And just to further add to the conversation about vaccines, at the Joseph Lee Center here in Jacksonville, for those of you who are in Jacksonville, at 5120 Perry Street, they're also offering the second booster. and that is 9 a.m. to 4 p.m. Monday through Friday. Thank you again.
All of it's free. All of it's free.
Right. Thank you again, everyone, for tuning in to Pause for the Truth. We'll see you next Tuesday. Good evening.
Good night.
Thank you.